Dick, thank you so much for being on the show.
Oh, I'm glad to be here. Thank you.
So I had a hard time finding the place?
No, I know it very well.
It's only been a few tries. It's like old home week now, isn't it? We're like family.
Listen.
So anyways, so Dick, could you please tell our audience what head and neck cancer is?
Head and neck cancer has to do with certain cancers that involve parts of the head and neck area, but not all of them. Starting from the top to the bottom, the ones you think about that show up are in the nasal region, at the nose, and the post-nasal region, and the sinuses. Down in the mouth area, you have the tongue. There are actually two major portions. One's the front part, which has to do with the tongue's talking, and the back part has to do more with the swallowing. Inside the mouth, you have the lining of the cheeks and the gums. It does not take care of involve the bony structure of the jaw or the teeth. And also the floor of the mouth, as I said, in the tongue, and also the hard palate. You then go down a little further. You have the what's called the pharyngeal area. That involves the posterior part of the tongue, the tonsil area, and then down into the larynx, which is the voice box, and the epiglottis. There are certain things it does not cover, and a lot of people get confused about it. One of which is the eyes, the brain. These are separate category of type of cancers that can occur in the head and neck. It does not include the skin, the scalp, as I said, the muscles of the bones. And it does not cover the thyroid or the lymph glands.
Wow.
I hope it's confusing because you've got different things that you can do. I forgot one thing was as the salivary glands are also included. And it's a different kind of cancer cell because of the type of cells they are from the other ones. But there's a lot of different types of cancers that occur in this area. And I think people need to understand there's just not one cancer. Like with prostate, you've got prostate cancer and that's all. For the women, if they have breast cancer, they've got breast cancer. But the head and neck cancers can vary as far as the severity because of the location that they are.
Wow. So I mean, I've always understood, like, theoretically, that you can, get cancer anywhere in the body, but
Right.
This is a pretty compressed area with so many possibilities. Are there any risk factors?
The risk factors, historically, it's always been felt in the past, like when I was in my training period, it was in the 1970s, and it was felt at that time that only problem that we can give you this, and that was alcohol and smoking. Today we know that smoking does, alcohol probably does not it's really not an agent that can cause it. But we've also found that there's certain viruses. People have heard the human papillomavirus, especially the women with the cervical cancer, but we're finding that this same strain and some of the other parts of the human papillomavirus are a causative agent for head and neck cancer. So we're finding viruses are a big cancer type of agent.
So since they now have that vaccine for cervical cancer based on HPV, do you think in the future there'll be any chance that there'll be a vaccine for these set of cancers as well?
Yes, I expect that they will, but as most people know who have had any experience with the human papillomavirus vaccine, it's really just for one strain inside there. So you're going to have to do some more studies to find out if it's a one strain or if it's multiple strains in there. And it takes it a while. It takes the people that develop the vaccines a while to make certain they're doing what it's supposed to do. But I expect them to do that.
Oh, that would be great, right?
Yes.
I mean, it is interesting because with so many of the cancers, like you said, they're finding that these mutations that occur genetically. I mean, from what I understand, all cancers are genetic in that the genes get messed up when they don't do what they're supposed to do. So let's say there should be cell death that they're programmed for and they don't, or there should be some other thing, but that doesn't necessarily make them hereditary. So is head, neck, or throat cancers, are they hereditary cancers? Are there any link in the families?
No, I've never read or heard that a genetic predisposition is there. It's more related to the tobacco and the viruses that we just talked about.
Wow. So in a way, it's kind of one of the kind of cancers that maybe we could have some prevention about, although you didn't fit into that category, if I remember correctly. You said you smoked, but it was like 100 years ago, not that you're 100.
It was about 25 years
He looks
before.
darn good for 100, doesn't he?
And when I talked about tobacco, not just smoking, a lot of people don't understand the front part of the mouth probably is not affected by the smoking tobacco. It's the chewing tobacco. And chewing tobacco is very dangerous for that. And the problem there is if you do get a significant cancer in the front part from the chewing tobacco, you may not be able to talk. And that, that's part of our society. We talk to people. And if you lose your tongue like that, you may not be able to speak very well at all. And that's tough.
That would be very terrible.
Yeah. And
especially for someone like me. I mean, I kind of tend to talk a lot.
Yeah. But, if you think about it, tobacco doesn't make any sense. And I did smoke. But when you stop and think about it, it doesn't really make any sense. Smoking or chewing. It's just a habit we get, and probably because the people we're around are doing the same thing, so it's a thing you just don't want. Don't want to be different than the other people.
So are there any symptoms that we can watch for?
The symptoms that can occur for the head and neck cancer, as you can remember earlier on in discussion of where these cancers can occur, it will oftentimes depend on where the cancer develops. Abnormal bleeding from the nasal or mouth area would be a very obvious one if that is occurring. There was one gentleman I read about, and he had bloody noses for a couple of years, and they evaluated him, biopsied him, nothing was found. It turned out he did have a significant postnasal cancer, and he actually ended up losing his entire nose area. So the earlier you get him, the better off it is. But the other symptoms can occur: a lump in the mouth, a sore in the mouth that just doesn't want to heal. And I've seen a lot of people who have had one, and not that it's been neglected, but the biopsy just didn't show anything, and later on another biopsy showed that it did. Also, in my situation, I had absolutely no symptom at all until I found a lump in my neck, because my cancer had already spread from the area in the tonsil on the left-hand side and had gone to the tongue, which had not bothered me at all. I was still swallowing, talking more totally normally, but it went to a lymph node in the neck. So a lot of people can show up with a lymph node, which means it's already spread outside the original area.
Is it usually like non-symmetrical? In other words, if you have a lump on one side but not on the other, is that more?
Correct.
Okay.
And a lot of people ignore these lumps. I had a gentleman that came into my office after I went back to work, asked about what happened. He was about 2 years younger than I am, and I told him about the lump, and he came in to see me again about 2 months after that, and he said, "Doc," he says, "you got a lump in my neck. Would you take a look at it?" And as soon as I felt it, I knew exactly what he had. He had head and neck cancer, which was flabbergasting to me, because for 30 years of my practice, I never saw a head and neck cancer until I had it. And then after that, I saw a whole bunch of them. And also, the other symptom we should talk about, since the voice box is involved, hoarseness or abnormality in that area. soreness, bleeding, things like that, and they need to be looked at. Now the question is, what doctor should this?
I was going to say, if
should you
we
go
have
to?
one of those symptoms.
Yeah, probably you should see your primary doctor first, and if he sort of or she doesn't really do much about it or isn't that concerned, you should then go see an ear, nose, and throat doctor. And you have to be an advocate for yourself. I don't care what kind of cancer you have. Because my daughter had breast cancer, and they were not doing very much, and she pushed, and she certainly does. She did have breast cancer. So anyway, back to the head and neck. If the ear, nose, and throat doctor really doesn't answer your question and you feel uncomfortable, there are ear, nose, and throat doctors who deal primarily in their practice with head and neck cancers. You need to see one of them. You need to stand up and say, I need a referral if it needed one for your insurance company, but you need to see someone who really sees it enough to feel comfortable that you do or do not have it.
And then how do they treat cancer when they
Okay.
find it?
Well, first of all, once it's established that you do have it, they usually will do a needle biopsy, especially with the lymph nodes in the neck. It's a very simple thing to have done. I mean, it really caused them no discomfort when I had mine, and they were able to say, yes, you do have a head and neck cancer. Well, then you have to end up having either CT scans or MRI scans of the area and the neck area to see if there's other involvement that we're not picking up. And then usually what the surgeon will do is he'll do a procedure where they will take you to surgery, push you to sleep for a very short period of time where he can really get back in that area, which I don't think any of us want to do if we're awake, and do some biopsies to help him or her evaluate what surgery am I going to have to do. How invasive is this? More invasive than we thought at first. After you have the scans and the evaluation, then you have your surgery. These surgeries can be very simple. We had one girl, she just had it in her tonsil. They were able to take that tonsil out, and that's all she had to have done. But in my situation, since it involved my left tonsil area and the part of the tongue, and also they had to do what's called a lymph node evaluation, where they do a total neck, where they take that part of the side, that side of the neck open and take all the lymph nodes out, because they need to evaluate how much has it spread. And my procedure lasted about 10 hours, and it's going to be grueling for the doctor, for the patient. You sleep through it, but
So not so bad, huh? At least not the part while you were sleeping.
that's right. And,
Waking up, I don't know.
well, you wake up and you can imagine, even you can't really prepare yourself for it, because you cannot probably see it on this on the camera, but they opened my jaw to break it apart so they could get into that area and properly take care of it. I've had a tracheotomy, so that's something I knew I was going to have, and depending on the doctor and the discussions, I have voted to have a tube put in my stomach so I could eat if I could not chew and swallow very well. Until I could get back to that point, then I had it taken out. So lots of things you really have to deal with afterwards. But they're not end of the road, but it's something that you have to be aware that there's some changes going to be in your life afterwards. As far as the treatments after other than the surgery, excuse me, because they want to take that out, as much of the cancer out as they can, because the only other treatments you have is radiation and chemotherapy. So after you have your surgery, you have to wait 6 weeks before you can have the radiation and chemotherapy, because the radiation would not allow the incisions to heal properly. So you get, depends on how the doctor decides, or the radiation therapist decides he's going to give, how much and how often. And usually it's about up to about 30 sessions where you go in and get the radiation therapy. And the chemotherapy is usually given concomitantly. The chemotherapy that's done is a type that helps make the cancer cells more sensitive to the radiation. You do not lose hair, although lost hair from other reasons, but you don't lose your hair as some of the other ones, other chemotherapy agents. And yeah, at the end you're pretty well worn out. But I went back to work after 2 weeks of the end of my treatment. It really wasn't that bad.
And how long was your treatment?
Treatment
from beginning
went
to end?
About 6 weeks. Because there's 5 times a week, and 30 would be 6 weeks. And yes, it takes you a while to gain the strength and energy back that you had before.
So it sounds like you went through a pretty grueling treatment and recovery process. What did you do to cope with all of that?
It is a very hard treatment process of the 6 weeks of the chemotherapy and radiation. And before that, you had to wait a period of time of 6 weeks. Then you had your surgery. So it's not something that's over with in a week or two. And it was very difficult, and I was not that much aware of any support groups during that time. I didn't even get involved with the support groups until after all my treatments were done. And it really has helped me, because even though being a physician, I had never seen or taken care of a person with head and neck cancer and didn't know some of the problems. And I learned very, very quickly. Talking to other people and find out a lot of things I had was something that is common and you learn to deal with. A couple of the things specifically, one of which is called trismus. That's where the jaw is affected by the radiation and the surgery, and you just can't open your mouth fully. And you have to work at it to get that back so it opens up properly.
Is that painful as you're working through it, or is it more
Not
just
really.
rigid?
You know,
Okay.
there's multiple ways of doing it to bring it back to normal. And the other one, which is probably lifelong, and that's the effect of the radiation on the salivary glands, and you get a dry mouth. And that's something you have to really, you don't understand until you talk to people who have been through it and have evaluated, or not evaluated, but have learned how to deal with it properly. Mine is not back to normal, but it's adequate, and I can live with it. I always carry water with me, and when I eat, I sip water constantly during the meal to help for the moisture. And the other thing that's surprising, that probably got me to the support group more than anything else, and that's taste. There was no taste. I told my wife, I said, honey, everything I try to put in my mouth tastes like cardboard. And she somewhat laughed at me, but not in a mean way. But she said, how do you know what cardboard tastes like? So when I went to the support group, and I told them about this taste, they all sort of laughed and said, don't worry, that's going to go away. And it does. Everyone I've talked to gets back to 90% or more of their taste so that you can enjoy food. The thing that affects your eating is the dry mouth. But each person has to learn how to deal with that. But also in coping with it, you have to have somebody, a caregiver. I luckily had a wonderful wife who was there and helped me during that. And everybody I've known has had some person who was there to help them get to their treatments or just be there with them to help get through it. It is a hard thing to deal with. But you have to make a decision. If you don't do it, the cancer will cause your death. But most of the people can do very well.
Have you made any changes to your life from this experience?
I take some of the things not as seriously, other than just life itself. My family, my daughters, our son, and our grandchildren. They're more important than anything else.
Do you spend more time with them because
Trying
of that?
to.
That's nice. And Pumpkin and Pearl Bailey.
That's right. That's our 2 cats. And we have 2 dogs.
I know, and I always forget about them.
Princess and Pierre.
Ah, Princess.
Yeah, Princess and Pierre are 2 dogs, and our cat is Pumpkin is a calico, and Pearl Bailey is just a normal cat.
So do you think, there's so many things, about pet therapy, for example. Do you feel that, was there any, did that help? Was there times you didn't feel well, the kitty crawled in your tummy, or I don't know, got that warm feeling from your...
I'm a strong believer that animals help. I don't think, between my wife and myself, we'll always have an animal of some sort. And the dog, they're different. Dogs and cats are really just totally different pets.
Mm-hmm.
That's all you can say. Anybody that's got one or both would understand it. And we got 2 of each, and we enjoy them. And but you have to take care of yourself and be aware of what's happening to your body. And if in doubt, get to see someone and evaluate it, no matter where that might be.
Did you have any high stress level or anything like that at the time that you got sick?
No,
Not really?
I was doing great. I was watching my diet better. I was trying to lose some weight, and I was working out, and that's actually where I found the lump. After the workout, the place I went to had a wonderful shower place, and you can shave afterwards. And I was shaving. I just turned my head just right, and I said, "I wonder what that lump is," and that started it all. I felt wonderful. I had no symptoms. And that's a scary time.
I was going to say, I think that's one of the most frightening times. I was in tip-top health. I meet a lot of people in my work that were in just the top of physical health when they were diagnosed with cancer. And I think it causes a distrust a little bit about your body and about feeling well. So with the fact that you've now been 6 years out, I know you had mentioned that at 5 years with this particular type of cancer, unlike other cancers, it's considered cured. But do you still have any fear or ambiguity niggling in the back of your mind? Or do you kind of pretty much say, I've been there, done that, fought it, I'm ready to roll on out with the rest of my life?
Yes. Luckily, in the kind of cancer I have, if you do make it to 5 years and all the tests don't show any evidence of it being in your body, you are considered cured. Unfortunately, some other cancers, you cannot say that. And so I'm aware of other possible cancers, because just because you had one doesn't mean you won't have another one too. So it's a matter of just being aware and trying to help other people. I find the support group tremendously helpful, and I'm a facilitator for it. There's 2 of us, and that just means we help run the meeting. And the people are really coming, and most of the people that are there are people that have been there for multiple years. They enjoy coming to it and helping other people. And one of the things we did not talk about, and that is I forget what it was.
The fact that the support group, people that actually come to the support group right after diagnosis, but prior to treatment and surgery, that's okay, but they tend to that real fare much better.
Yeah. The support group, most people don't get into the support group for head and neck cancer until after all the treatments. And it's really too bad. Even myself, I think if I would have been able to come to a support group either before I had this surgery and other treatments, I would have done better. I would have understood better the problems that do occur during that time. The doctors don't have the time that the support group can to deal with it. They talk to you about trismus and just...
they skip the cardboard talk.
Nobody talks about that. Nobody I'd heard about. So we have been lucky enough to get a couple people in our support group before they had their surgery or any treatment. And they all have said that they think they've done better than a lot of the other people because they understood what was happening and what occurs. And, it's too bad we can't get them. The doctors have tried, and the doctors are doing much more giving information to the people in the offices about the support group, that a lot of people just don't come until after the treatment, and they start saying, this is a lot worse than I thought it was going to be. But I live a very normal life now. I do carry water with me, but much less. I don't panic like I did at first. If I go in the store now, a lot of times I don't take any water with me. When I first was doing it, I carried a bottle of water with me all the time.
And since we live in Arizona, you should be carrying a bottle of water with you all the time anyways.
That's right.
Well, I let our audience know before you came here that you had gotten the Humanitarian Award from the Desert Cancer of Arizona Foundation for your work with the support groups. So I really do appreciate that you were willing to bring these support groups to fruition, because though, as we've said, it seems like there's a small populace of people who get this cancer. That's one of the main reasons why it's so necessary, because it's so far-reaching, once someone has it, and you don't just get to run into somebody in the grocery store. Although I will tell you, kind of like what you said, after meeting you, I was at a model of, the electric flying airplane things, and sure enough, a gentleman sat down and he had a scar that went kind of like this, and he had a little bit of a speech impediment. Actually, you don't have one like he had, and that was the first thing I thought. Okay, I don't think I've ever noticed this in my life, and it was like 2 weeks later, and I thought to myself, oh, I wonder if he had some type of cancer for that. So it was interesting that you just sort of get more aware.
Yeah, it's interesting. You do find some people, and nobody comes out and whatever cancer you have and just waves a flag and say, "Oh, by the way, I've had cancer." We were on a cruise one time, and a lady walked by me, and sure enough, and she had the same incision on her neck and all that I had. And I said, I don't know if I should go over and talk to her, but I did, and she was very nice about it. And she probably had it about 2 or 3 years prior to mine. And it's just amazing. My brother and I were playing golf back in Ohio, and they matched us up with another two gentlemen. And for one reason, I don't know why, the one gentleman started talking about his relative, and he was going on and on, and she had cancer of the tongue, and she has this thing on her wrist. And so I pulled my sleeve up, and I said, did it look something like what I have on my wrist? And he was just totally shocked. And what's even more interesting now, we're in Ohio, and I live out here in Arizona, and I'm talking to him, I said, and he was telling me his relative is going to be down here in Arizona this winter. So I said, have her come out to the support group. And she has, and we sort of laugh about how it all occurred. It's just one of those things you can't plan.
Well, it's so strange because you were sitting here saying how it's kind of rare. It's only 3 to 5% of the cases of cancer, and it makes it sound so nebulous. And then the synergy in life that happens, and the synchronicity of events. It's like once you're aware of something, then you start to notice. I mean, what if there's only 40,000 people a year, and you run into 6 of them in one,
right.
In 1 year time? It's like, wait a minute,
well, And you've been to our support group, and you've seen a couple of people who had the voice box,
right.
And the one uses the vibration, and it's not really obtrusive at all. Mm-hmm. It doesn't bother me at all. Mm-hmm. Some people just don't like the idea of doing it, but she's able to speak very normally, and lives a very normal life. And that's the important thing, is have a positive attitude. Once you find out you have cancer, find out what it takes to take care of it, and do it, and fight it. Yeah. Don't give up on it.
And I want to acknowledge to the audience that you'll have had a chance by now to see some of the people in the group, and afterwards hear a little bit of testimony from each of them. And these really is a remarkable group of people who have faced some pretty hefty challenges and just come out positive and happy and living life. And that's what we're here at Overcome at Healthy Power TV, is showing people and letting them know that there are so many things that could happen in life that are nothing in comparison to something like this that we let get us down. And yet there are some things even way graver than this as well. And that, inside of each and every one of us is that powerful person who can get through, get on, survive, and overcome.
Right. And you and I talked about this before, and that is, because the head and neck cancer occurs in the mouth area, and that is social. You go out with people, and I didn't want to go out for a long time because I couldn't eat very well. I had a lot of trismus. It took me a long time to get my mouth open enough to eat. I didn't have an appetite because food doesn't taste any good when it tastes like cardboard. And it doesn't bother me anymore. I can go out with people, and I don't drink any alcohol, mainly because it still burns my mouth, and I was never a big drinker anyway. But all the social things you think about, especially eating, you go out someplace, people always eat, and it's just tough, and it takes a while. But after so many years, you're back to normal, and people accept you for that.
Thank you again, Dick, for being on the show. I really appreciate you coming on and sharing your story.
Well, thank you for having me come here. Hopefully, the information we gave them today will help them be able to tolerate or understand head and neck cancer.
I think so.
Thank you.
The support groups have been wonderful in that here you find people who really know what you're going through. they really know what it's like not to want to eat, having trouble eating, having the dry mouth, the different things that happen as a result of the radiation.
Right now it'll be 2 years in April. My doctor said everything's going okay. I've had a chest x-ray, no PET scan, so hopefully we just, keep plugging along. So we enjoyed it very much, and if you get to a support group, if you find that you have cancer, a support group is really, it's really going to help you out.
The support group, these people, they're great.